For the first time, the government is proposing voluntary guidelines to gradually limit salt in package and restaurant meals. So the FDA yesterday called on food companies to lower sodium levels. It hopes to prevent thousands of deaths every year from heart disease and stroke. Every day, Americans take in an average of about 3,400 milligrams of sodium. That's nearly 50% more than the recommended limit of 2,300 milligrams. That is a lot. Our Dr. Tara Narula is a cardiologist at Lenox Hill Hospital right here in New York City and joins us at the table. I feel like the FDA is trying to save us from ourselves almost, because we all know you can't eat too much salt. So how will these voluntary guidelines help us?
Yeah, so for many years, the idea of reducing sodium in the food supply has been proposed as a public health strategy.
Right.
But this is the first time that the government is stepping in and basically putting limits, voluntary guidelines on the amount of sodium. Why is this important? 90% of Americans consume too much sodium, and it's not from the salt shaker that you're using at home. 75% of the salt we get is from processed and prepared foods from outside the house. We spend 50% of our food dollars on food outside the home. And the FDA has said that the deck is stacked against the consumer, and that couldn't be more correct. And so what this is really about is giving power back to the consumer, taking that burden off the consumer. And it's estimated that by reducing sodium by as little as 400 milligrams, that's like a quarter of a teaspoon, you can decrease 28,000 deaths a year and save $7 billion in healthcare costs.
What is it salt does to you?
Salt increases the blood volume. It attracts water, which raises the blood pressure. And the blood pressure, when it goes up, you have hypertension, you can damage the arteries, the heart, the brain, the eyes, the kidneys. 1 out of 3 American adults has hypertension. 1 out of 10 children has hypertension. So this is a big problem. Hypertension is one of the biggest reversible risk factors for heart attack and stroke.
Are there limits for everyone, even if you don't have high blood pressure?
They are. These would apply to everybody across the board. And we know that as people age, that you are more likely to develop hypertension the older you get.
And
why do they put so much salt in processed food?
Well, it's for different reasons. One is taste. Some of it is to preserve the foods. So there's lots of different things that the salt brings to the table. But these are voluntary guidelines that are going to be phased in over time.
I love salt so much.
I do too.
I love it so much.
I do too. I used to do a salt shaker before I taste it, which I know is really stupid with 2 O's. And so many people think that if you're not shaking, then you're okay. What are the hidden foods that contain salt that we don't even think about?
So the Salty Six, the American Heart Association has a graphic for that. Yep, pizza, soup, sandwiches, breads, rolls, poultry, cold cuts. You don't think it's in there, but it is. So the idea is that
pizza, you say?
Pizza, which I love too.
Cold cuts, that's interesting. Cold cuts.
Soup and sandwiches.
Yep, exactly.
I love soup.
So over the next 10 years, the idea is to phase out the sodium to about 2,300 milligrams a day. Over the next 2 years, to about 3,000 milligrams a day.
Lettuce and celery, so tasty.
I know.
Thank you, Doctor.
Thank you.
Hopefully the FDA will soon recommend more bacon. Less salt, but more bacon.
You love the bacon.
We would like that.
Thank you.
Thank you.
Thank you,
Good to
Dr.
see you.
Tara.